What about the signs and symptoms of the disease in humans? Let's start with the bubonic plague. So, as we have said, the bubonic plague results from flea bite or direct contamination of an open skin lesion by plague-infected material. So, from the localization of the flea bite, infection spreads via the lymphatic system to regional lymph nodes. The incubation period in that case goes between 2 to 6 days, followed by a sudden onset of illness with headaches, chills, fever, malaise, and pain in the affected regional lymph node. This painful is very characteristic of this plague lymph node, and that's one of the rare specific characteristic of this plague form of the disease. So it appears buboes, and for instance, in this picture, you have a large bubo under the jaw of this patient. So that's very inflammatory, there is a swelling, and as I said, that's very painful. The case management, first it's important to maintain the standard precaution for blood and other body fluids because there is a risk of contamination if you are in direct contact with an infected body fluids and you have a skin lesion, for instance. So the standard precautions are very important. And after the treatment, use quite common antibiotics and for instance, tetracycline, doxy or chloramphenicol. And an example of treatment for this bubonic form of the disease, that's doxycycline, 200 milligrams a day during 10 days. Aside the case management, it's important to implement control measures. First, it's important to note that the patient, in case of a bubonic plague, is not contagious. That's a big difference with the pneumonic plague. So the main control measure at community level will be based on vector control and rodent control. It's important to note that it's very important to start with the vector control because if you start killing the rodents, all the fleas being on the rodents will look for other hosts and you increase the risk of human transmission. So first, vector control, as illustrated on the right side of the slide, then rodent control. In addition, depending on the situation, we can give a chemoprophylaxis to the person living in the same home, but it depends on the situation.